Hello, everyone, and welcome back to the Pelvic Bowl. This is episode number 4. I'm Dr. Krystal Lynn Couture, a physical therapist and an acupuncturist specializing in pelvic health, in particular, teaching pelvic health to acupuncturists around the globe. Today, I am working with Dr. Julee Miller, who's an acupuncture physician, doctor of acupuncture and Chinese herbal medicine, as well as a FABORM specialist acupuncturist. Here's her bio. At Pointe, Jacksonville Acupuncture and Wellness Clinic, we believe women deserve healthcare as unique as they are. As Jacksonville's premier integrative medicine clinic, we provide specialized care that addresses the root causes of women's health concerns, rather than masking symptoms with one-size-fits-all solutions. With a background in sports medicine and rehabilitation spanning 30 years, Julee has seen too many women dismissed, misdiagnosed, or offered inadequate treatments. Women with endometriosis suffered for years before diagnosis. Others were prescribed birth control for irregular cycles without investigating deeper issues. Too many couples were labeled with unexplained fertility and left without answers. At Pointe Jacksonville, we're changing this narrative. As one of only 2 ABORM certified fertility specialists in Northeast Florida, Dr. Julee helps women struggling with premature ovarian insufficiency, PCOS, and endometriosis conceive naturally and improve live birth outcomes. They have a specialized pelvic floor rehabilitation program, which restores function and confidence in women facing postpartum incontinence and chronic pain. Beyond fertility, their expertise extends to chronic pain, autoimmune conditions, and neurological disorders, earning them a place in the 2004 Olympic sports rehabilitation team. Wow, Julee, welcome. It's so nice to have you.
Well, thank you. I'm so excited to be here.
It's a pleasure. So, Julee, I want you to tell me a little bit about your journey beyond your bio with your words, kind of leading up to your time with me, specializing in pelvic care for acupuncturists.
Gosh, that's a long journey for real. I started in the world of sports medicine. So before I even went to school for acupuncture, I was doing sports massage and athletic training, and that was my undergrad degree. So that was my first love, and that was because as a child I was a volunteer in a VA hospital in their physical therapy department. So I was intended to be a physical therapist back in the day. So I went to school to be that and took a little bit of a right turn and went into sports medicine instead. So as I was treating professional and Olympic athletes, I met an acupuncturist who was also treating our same clients. And I got a treatment, and that was it. I knew that I needed to know more information about acupuncture. So then I went on to acupuncture school, and I knew that I was also still going to maintain like the chronic pain treatments, the acute chronic pain, sports medicine type of thing. And then within 2 years of doing that, I started having friends and or patients who were struggling with fertility. And I knew that acupuncture could help. I just hadn't had that type of experience or education yet. So that started my women's health journey. And it's been my love for so many years. I've been specializing in women's health for, gosh, I think 12, 14 years now. And I then went on to get the ABORM certification. I absolutely have such a passion for women's health because it's such a piece of the puzzle that just remains either ignored or misunderstood or not talked about, that there's so many things that are swept under the rug. And there's so many things that women have been told to deal with for centuries. So it's always such, I love meeting new patients and I love walking them through their care because it's always such a puzzle piece and it's always individualized, and it's so appealing to me and gives me so much joy to be able to find that puzzle piece that's been missing. And then to just see that glow come back in women's lives when things start clicking for them again and they're walking in their path of health, and they're having treatments for things that they just haven't been able to find treatment for. So it's such a passion for mine. And I know that being a woman, it's more of a self-service to me as well, just because I also have we all have our female struggle. So it's helpful in so many different arenas. And then, of course, in the whole pelvic world, the pelvic floor certification that I just went through with you, it just opens up so much more. So even though I've been specializing in fertility for so long, that now next missing link of adding pelvic floor therapy to so many of fertility, women's health, and back pain patients, it just really is just opening up so many different things that it helps to fuel my love for continued knowledge and caring.
I love that. I love that. I want to just go back to something that you said a few moments ago, which sort of made me think about, the nature of this underserved population, right? And how, while so much of what we do has to do with the intricacy of acupuncture and the intricacy of herbs and the knowledge that we've established and gained and the clinical wisdom, right? But then there's this other part to that, which is simply allowing our clients to be seen, heard, and to not be told they have to just deal with this, right?
Yeah, for
Yeah,
sure.
for sure.
Yeah, and that's, so treating endometriosis and PCOS patients, that is time and time and time again, the symptomology that patients show or come to me with, to me automatically, I automatically think, oh, that's a red flag. That's a red flag. Oh, that's a red flag. These all to me sound like endometriosis. These all to me sound like PCOS or some sort of hormone imbalance. But when these patients go to other practitioners, Western doctors, they're not being heard, and they're not being given other options. And a lot of time, unfortunately, because the Western medical world is inundated with patients, they're looking for kind of a quicker, potentially treatment for patients. So there's always medications. There's always 100% of the time, there's always birth control. I can't even tell you how many times I was offered birth control through the times that I personally went to a gynecologist, and I was never interested in it.
Yes.
It's just their number one thing here. Well, you're not on birth control. Here, take this.
Right.
It's just the layering. And then once a woman is on birth control for so many years, they're usually put on it at a young age because there's some sort of difficulty. There's heavy bleeding, there's painful periods, they're trying to moderate things so that they can go to school. So then they do that for many years, 10, sometimes 20 years, and now they want to have babies, and then they get off birth control. And then that's where a whole new set of things happens. Either the same symptomology shows up or other things, because the birth control is masking a bunch of things. It's just time and time and time again, every day, all day long, is the same unfortunate story. So, I think it's great because a lot of my time is spent in education. A lot of time, my time is spent in telling patients how their periods work, because we've never been told that. That's not part of a general education. So many adult women have no idea really, except for that sometimes they have a menstruation, but that's it.
Right.
So I love doing that too, because once that starts clicking and once patients understand what the next phase is going to be and how that happens and what hormones are involved and maybe how changing diet and lifestyle can vastly improve that, just doing that, to me just brings me a lot of happiness.
Yeah, it's such a big part of what we do to bring in this educational piece. And I think that educational piece is less about like just like inundating clients with knowledge, right? And it's more about helping them to embody the patterns that are occurring in their body. Some that are, the natural normal rhythms, and others that are going against that. And for them to be able to identify what is common for them, what is normal for them, and what is not, and to have practitioners like yourself that are able to navigate through that journey is such a special resource. And it is something, it is still a missing link, even though we're talking about women's health today much more than when you or I were having our first menstruation, right? It's way more common to talk about now, but it's still not talked about with that education. It's still not talked about with this reverence for what the bleed means and for what can occur within the body and the spectrum of what is, within the normal range and what is definitely not within the normal range, right?
Right. Sure. There's so many things that women are just putting up with because they're told, that's what you do. You just have to deal with it, and that's how it goes.
For
But in
sure.
reality, there's just so many things that can make the life much easier.
Absolutely. I agree. And so many of those things, like, we're awesome. I know you're an awesome herbalist. I know you're an awesome acupuncturist. And I think I'm a pretty awesome acupuncturist. But so much of like the really good stuff comes from these conversations that we share with clients, to just give them these
For
little
sure.
tips, like, your iced coffee is doing this to your body, or whatever it might be, right? Eating this food is going to tremendously impact, your world. Um,
Yeah.
but what's really interesting that you just brought up, right, is this sort of sense that women, we just have this natural, like, consciousness that tells us, yeah, we just have to accept this. We just have to take this. This is just, this is part of the reality of being a woman, being a mom, being a business owner. And like, why is that the norm? This is going off the cuff of our conversation a little bit, but why is that the norm? Because
Right.
I see that come in so often with, the realm of pathologies that we see the most. Obviously, I do women's health and pelvic health as well. So we see a lot of really similar pathologies, but so often that's the trend, is women saying, right? Like, I just have to accept this as normal.
Right.
Like,
Right.
do we?
And it's such a good conversation because, there's just so much expectations for women's, and silent expectations or spoken expectations. And, there's a lot of times, more common than not, it's a working woman plus a mother as well. So there's lots and lots of responsibilities that are taken, and women take charge of those responsibilities. And then by and large, they don't have time or even the headspace to even think about themselves. So just recently, I had a prolapse patient come in. She was a young mom who also was a very career-oriented person that, this we're stuck in the bounce back phase of, as soon as you have that baby, snap back. And she, followed that and was, trying to get back into work within 4 weeks. And then within 6 weeks, went back to the gym. And, your body isn't meant to do that. In traditional Chinese medicine, we're supposed to take 40 days. Wouldn't that be amazing if we had those cultures here in the United States, where 40 days after you give birth, after you push another life out of you, that you can rest? That would
Right.
be amazing, but we don't do that here. So it's that bounce back mentality that really is also causing a lot of harm to us too.
Yeah, for sure. Yeah, you're right. I think those two sort of components, right, of the bounce back and the stand in, accept responsibility expectation, that do limit us. But I also see that once someone goes through a course of therapy, very often we help their symptoms, right? I feel like that's the easy part for us, is helping a lot of their symptoms to get better. But then I see these cool things happen, and I bet you do too, where women become empowered through their sessions, and they
Hmm.
start to feel, as their symptoms start to improve, they start to feel better. But also something inside themselves changes. And that's, really the spiritual nature, I think, of our work, right?
Yeah,
Yeah.
agreed.
Yeah, cool. So, what was the catalyst that made you say, you know what, pelvic floor therapy is a bit of a gap with my fertility and women's health clients, and I want to go there next? What was kind of the trajectory?
Yeah, I think because I was seeing a consistent rush of patients with a diagnosis of BV, just constant bacterial vaginosis. It was like the new umbrella term of, this is what I'm struggling with, this is what I'm diagnosed with, constant chronic UTIs. And it's of all ages. It could be young reproductive women or menopausal, doesn't matter. Just a constant and consistent new diagnosis phase of having BV.
Mhm.
And then, those patients are then being put on many, many rounds of antibiotics. And then, of course, that's then destroying their gut health. And, it's just kind of like a cyclical and cycle type of chronic thing that was recurring. So finally, patients are starting to get tired of doing that. And then they're asking for other help. So it was at that point in time where I realized this isn't BV technically. So there's a hormone imbalance that's happening. There's other constitutional changes in Chinese medicine that I'm seeing and witnessing, that by adding in herbs and or trying to dial in different food therapies and adding in acupuncture can very much treat that. And then by adding in some pelvic floor treatments, more specific than what I already knew, well, then that also helped to decrease other symptomology that wasn't even thought of or even wasn't even considered an issue because there's this overlying thing. So it just to me felt like the natural progression of what I needed to add into women's health.
Yeah, for sure. That makes sense. Thanks for sharing that. I think so much of the BV as the umbrella term, right? As we would sort of think of it in Chinese medicine on the simplest terms. And of course, there's a lot of complexity and patterns, right? And this is not an educational workshop where we're going to go through a lot of that, but we tend to think about stagnation, right? And sort of the condensation of these damp heat sort of fluids that have nowhere to go, right? So if this existed anywhere else in the body, we would want to move that chi, right? We wouldn't want it to
Yeah,
stay there.
right.
And the antibiotics that are so widely prescribed over and over again don't move chi, you know?
No.
And so when we work with the pelvic floor, we're and specifically getting into those bigger muscle groups, not even talking about the little muscle groups of the pelvic floor, but those bigger muscle groups, we're starting to move blood. And if we're moving blood, then we're able to move chi. We're able to start to get out of that phase of stagnation, and we can sort of start to get the organ pumps going again so that the lower jiao isn't so way down and this condensation of fluids, can start to move, right? I don't know, that's kind of how I see it.
Right. And there's just so many different access to trigger points that most people, I think, are so contracted, right? That they're told even with Kegels, right? So pelvic floor and Kegels and exercise and contract and tightened that really sometimes are over contracted and not necessarily understood. So once you're able to access those trigger points as well as help them to release that stagnation and or just contracted nature, then so many things can move. So, and that's also combined with emotions, and that's combined with bowel movements and urination. And it's just by putting that all together, it just gives such another layer of relief as well as moving through what people are experiencing.
Yeah, and I think the common thing that people forget when there's a trigger point, right? We know that that's a contracted tissue, and I think the general population sort of understands that that's a contracted and compressed tissue. But what we sort of forget is that the elasticity is decreased when we have contracted tissue, right? Especially when we have a trigger point, because all those muscle fibers are bound up around each other. So we have less elasticity and less stretchability. Is that a word? I think I just made it up. But we have less stretchability, then we're going to have, less control of those pelvic floor muscles. And when we have less control of those pelvic floor muscles, we start to see those other organs not be able to have their full spectrum and not be able to move, that condensation or that stagnation. So I think that's an important part to the trigger point. So if you're a client that's listening, the stretch is important. And if you can't stretch because there's a trigger point, that's something that Dr. Julie can help with.
For sure.
Yeah. Yeah, right on. So what would you say has been your greatest asset to your clients since you've taken the pelvic care practical?
What do I think is the greatest asset?
Yeah. Like what's
Being
been,
a pelvic floor.
yeah, maybe it could be like a take home, like a technique. It could also be just a way that you are with the clients. It could be a knowledge thing. It could be really anything. But what's your kind of biggest like light bulb moment through adding in pelvic care?
I think one of is going to be 90% of back pain in women's health. In any female, 90% of back pain also has some form of pelvic floor dysfunction.
Mhm.
And I think that that has been such a big aha because as an acupuncturist prior to doing pelvic floor, you look at very specific patterns for back pain and or sciatica.
Yes.
And rarely do you think about adding any kind of pelvic floor structure. You might think about like the psoas muscle, which is an anterior muscle, if things aren't moving or working. But it wasn't until I did the pelvic floor modules that I now always think of and always do a pelvic floor the pelvic floor questionnaire. I always do that as well with a low back patient, which a lot of times patients are curious as to why I'm even asking all these questions, but I will find a distinct correlation between the two. And by adding that, that person is getting so much better, so much quicker. So I think that that has been not just in women's health, but also in chronic pain patterns. It's been incredible.
Absolutely. Yeah. So the questionnaire that you're referring to, the PFDI, Pelvic Floor Disability Index, is a great objective.
Yes.
Yeah, it's a great objective measure for us to share with our clients and clients for you to be able to see the progress within your pelvic floor in the categories of urinary health, sexual health, and bowel health. So it's really cool to be able to use that and for us to see how the back may be impacting the pelvis and the organs within the pelvis, or how the organs within the pelvis may actually be impacting the back, and how we can kind of concomitantly treat those to really support clients.
Right.
Yeah.
And it's also the other one is it's also not just a woman's health issue, right? So anyone with a pelvis can have pelvic floor dysfunction. So while we by and large mostly talk about women's health in pelvic floor world, men are also affected by that and can greatly improve their conditions with treatment too.
It's so true.
So those are my two.
I love those two. I think they're awesome. It's such a funny thing because so often, right, we're sitting on this soapbox as women's health acupuncturists, like we're standing up for women's health because it finally has a voice and we are sharing this voice. And then there's this little part of us that's like, oh wait, but there's this other aspect.
Oh, by the way,
right?
Yes.
There's men that are talking about this even less, right, than women are. And unfortunately, while it's birth control for women, very often it's the erectile dysfunctions for men. This treats
for sure.
And it doesn't. It is not the total answer. So often I end up seeing a male client who comes in with, some form of erectile dysfunction, whatever that might be. And I do like one treatment and they're like, oh, wow, this completely changed my life, whether that's for pudendal neuralgia or treating the tibialis nerve or something like that. It's like all of a sudden, without even going directly to the pelvic floor, it's like we're addressing their concern. And they're like, I don't need the Cialis. And it's like, okay, well, let's get a few more sessions under our belt before we, throw it away totally. But like, this is an awesome start. And then there are other conditions, which I feel like men are not able to talk about in our society so often, which do have to do with pelvic pain, which do have to do with urinary frequency and retention. And what we do specializing in pelvic health is great for those conditions as well.
Yeah.
Yeah.
Totally agree.
Yeah, for sure. So back pain and pelvic pain are correlated. And don't forget, anyone who's got a pelvis can have pelvic pain and pelvic dysfunction.
Don't forget. Yeah, totally agree.
Don't forget. Yeah. So, do you have a pelvic floor or pelvic care case study that has just like really warmed your heart, that has been like such a success story, that you just want to share it with the world?
I do. I do. So it's a male patient, who mid 50s who, has bladder cancer. And he came to me 2 years after finding that he had bladder cancer. He had moved to the area and he had had treatments in other states. And he is a fireman, now retired. And the bladder cancer was only caught because they have to do intense physicals every single year. And he had no symptoms whatsoever, nothing. So when they found this, it was a complete and utter shock to him. So he had gone through rounds and rounds and rounds of chemotherapy and radiation before finding me in Jacksonville. So he had moved to the area and had acupuncture in the past. But he was just trying to find relief because per his words, 24/7, it feels like fire in his penis just all the time. So he's had really invasive treatments. So in adding, he'd heard, pelvic floor therapy has become very, very popular over the past couple of years. And so he knew that he needed the help and also knew that I also did it. So he came in and he drove an hour for the consultation, came in and agreed to do a treatment care plan. The best thing that I ever heard, the next time he came in from a treatment, we did a consultation and a treatment. After one treatment, he had not had pain for one entire week.
Wow.
Which was the longest time he had had no pain whatsoever. It didn't require him to have any kind of pain medication. He's on gabapentin and some very strong medications. He didn't have to take any medication. He didn't have difficulties with any kind of pain for the entire week. And to me, that was just so heartwarming because I thought, holy crap, it was just one treatment that I gave him. Like, you expect with somebody with such a long chronic and intense medical history that it's going to take time. It really does. It's like an onion. It takes time. And there's, times that you expect minimal progress before there's great progress. But with him to have such relief for such a long period of time after one treatment was so amazing. He was crying. He was just so happy to have found this kind of relief. So yeah, exactly.
Yeah. So
that's
special. Yeah.
it was a surprise to me that I could reach even more people. So
Definitely. Was he undergoing like chemotherapy or radiation or anything like that during your course of treatment?
he is still undergoing treatments, and he was in a window of opportunity where he was getting one treatment a week. So in between those one treatments a week, he was getting acupuncture.
Great.
So he was still under a course of radiation.
Wow. So that's awesome that he was able to be in a course of cancer treatment and still have those extraordinary results, because sometimes the cancer treatment it's necessary, right? Like if we want to continue to live on,
exactly.
It's important, but very often it's like we make a little bit of progress with the cancer and we have a symptomology setback. So it's really, really cool that you had such good results during that time and that he got to a place where he's more comfortable,
Yeah. Yeah, that made me feel great. And also, he's such a lovely fellow that you wouldn't expect that he was struggling with such an intense medical struggle at the time at all. He's so lovely, and he wasn't, a lot of times when we see chronic pain patients, you know they're in chronic pain.
Yeah.
The way that they present themselves, the way that they talk, and they're always contracted. And he's so lovely and so kind and open that when he told me his medical history, I thought, well, okay, this is to me a bit of a surprise too, just because the way that, he carries himself through the world. So that speaks to him as well.
I think that speaks to, you and the practice you have set up as well, right, Julie? You attract the people in that are the right people. And also, I think the right people, very often, if you're a client that feels like acupuncture might work for you, then that's the first step, right? The mindset is really the key. And that's not just true of, as they're often called, alternative therapies. That's sort of true of everything, even our Western therapies, right? I've had plenty of clients, and I'm sure you have had too, where they say, I know this medication that the doc wants to put me on isn't going to work. Well, it's not going to work because the mentality is there, right? The VA sent me to whatever, acupuncture, and I know it's not going to work. Well, no, then it's not going to work. But the mentality, if your mentality is there and you think there's something of a spark in this practitioner or this practice or this type of medicine that is practiced in this organization, then that is going to set you up to be more successful. Because it's a vibration, it's an energy, and that's what we're made up of, is this electrical energy.
Right. Yeah. And there are times that patients will ask me, do I have to believe in this for this to work? Because so many times, like, I don't know what acupuncture does. I don't believe, but I've done everything else. I'm going to try it. We'll see. Like, there's that ho-hum mentality. And that's always my response is, well, it's going to go so far.
Yeah.
It is a help for sure. But if once you start seeing that progress, then perhaps that will change your mindset a bit. But the more blockage you have going into it, then that's what's going to be met with. So It helps to have an open mind. But there's, as acupuncturists, as you know, we're commonly the last resort. So
Yeah.
people have gone through so many different varieties. Now that's changing. I've been an acupuncturist for 18 years. That's changing, and people are being more proactive, which I love. But we still see those that have gone through everything, including surgery, and still are miserable. So, it's education.
I've definitely seen an uptake, actually. I would say within the past year. This is really good reflection, Julie. I've seen an uptake, I feel, in the number of clients that are coming in and saying, generally I feel good, but I want to be prepared for when I want to have a baby, but I want to be prepared for when I go through menopause. And I'm like, yes, come on in. Like, this is the moment to
My
start,
favorite kind. Yeah.
right? Yeah.
Yeah.
So it's really
Yeah.
it's cool to see the spectrum, and it's cool to see acupuncture become positioned more for its intended purpose, which is, facilitating optimal wellness on the physical, spiritual,
Yeah.
emotional level. So I love that, because preventative medicine, whether Western or Eastern, it doesn't matter, right? What it is. Preventative medicine, sorry, I'm so excited. Preventative medicine is always going to be a step behind, right?
Yes.
Because
Yes. There's
there
no
is,
fire.
right, exactly. We're already in
Mhm.
the fire. So
Mhm.
it's reactive. We're automatically in a state of reactivity, which is just
Mhm.
not where we want to be. But if we're in a state of wellness already, then we've got a foundation. We have a base for treatment to move forth. And we have an understanding already of our own bodies, and the practitioners have an understanding of the body in front of them, which is, I think, a really cool place to be.
Yeah.
Yeah, for
Agreed.
sure. For sure. Um, So, what would you say, if there are other acupuncturists that are listening? What would you say to other acupuncturists who are thinking that, I may or may not be interested in getting into pelvic health? What would you share with them?
Well, gosh, that's a loaded question because I find that there's a lot of acupuncturists that are not interested whatsoever in pelvic health, and still don't believe that acupuncturists even have a role in pelvic floor therapy.
Mhm.
And to me, that's mind blowing. Even just like, having a C-section. Why wouldn't you think that there's not a role? Because that C-section cuts right across all the abdomen, all of the meridians, all of the scar tissue. That alone, how do you not think? So anyway, to me is mind blowing, but some people don't want to have such a high role in women's health, right? Or any pelvic health.
Right.
But those that are maybe thinking about it and thinking that maybe that could be a puzzle piece. If you're already in that thought process, I can assure you that it is the puzzle piece that you're looking for because you've already gone through potentially the other education of women's health and hormone balancing and maybe fertility, maybe pre and postnatal care. And if you're already on that journey, it's 100% going to be the very next step that you should take. And if this is, your passion and your mission for helping to improve women's health, because it is absolutely the missing link. So, yes.
Yeah, and talk a little bit too. I'm curious because you have another mindset as well, and we have really similar journeys. Obviously, I too started in sports medicine, and my sports medicine
Yeah.
clients then started talking about their pelvic health and fertility issues. And at the time, I was just PT, and I didn't know how to deal with them. So we have really similar trajectories. So, what would you say to a sports medicine acupuncturist or someone who's specializing in sports medicine that's like, do I need the pelvic floor?
Yeah. So the easiest response is that is going to be prolapse because if you're specializing in sports medicine, you're probably specializing in high level athletes, right? And so they will be most commonly affected by if it's a female athlete, it's going to be amenorrhea, right? So then that's a whole issue on its own. But there's also commonalities of prolapse or rictocele. So because of such physicality and such force, that should be something to be considered, which I know is often not considered with a lot of the pain patterns that are presented.
Yeah, absolutely. Absolutely. Is there anything else that you want to share about this journey, about your client stories, or anything else to just kind of wrap up today's chat?
Well, I don't, yes, I think what warms my heart the most is seeing patients and or staff members who work and are constantly in the clinic space and have gone through treatment and or are employees and staff who aren't practitioners but are in the world of women's health. It warms my heart so much to see young staff members learn so much about their bodies and then not only appreciate it and are able to help themselves with whatever struggles they have, but then start talking about it. They'll start talking about it to patients. They'll start talking about it to their siblings or their mother and say, oh no, if you do such and such, I found this is great. Or this sounds like maybe you have something that you should go be seen by. It just makes me feel so happy when I hear about it, or if they come and tell me, oh, my sister had this and I told her to do this. Do you have other suggestions? And I think, God bless America. I love that we live in a time that we are now so open about women's health and we're so open about fertility, menstruation, menopause is hot right now. I love that. We're living in a time that people are finally talking about it sucks to go through menopause. This is gross. I don't love it. I don't love the way I feel. I don't love my moods. I don't love the headaches and I don't love the pain.
Mm-hmm.
Please help me. And a lot of times nobody's helping them because they don't know. They're like, there you go. Good luck. So I love that that I've seen it go through this phase in the last 10 years. I've seen and have witnessed it and walked through it myself. And it just makes me so happy that we're in a time that it is out and about and people are learning more and more and want to talk about it more. It's great.
The ripple effect. Right?
Yes,
Yeah,
absolutely.
exactly. Right on. So if Julie, if someone feels compelled to see you in North Florida, tell us about where you're located, how they can find you on the interwebs or via the phone or all that. Give us your pitch of your
Yeah,
clinic.
I'm very reachable for sure. So my clinic name is Health Pointe Jacksonville, of course, located in Jacksonville, Florida. I have a robust website, which is hpjax.com, like Harry Potter. And Instagram is probably where you're going to find me easiest, and that's Health Pointe Jax. I'm also on Facebook. I'm also on TikTok, but don't judge those videos because I'm not great. Um, and LinkedIn. I'm everywhere, really. And it's all under Health Pointe Jax.
Perfect. That's beautiful. So thanks for sharing. If you do feel compelled and you are a client that wants to see Julie, she is an amazing practitioner and would love to see you in her practice. Also, her website is killer. And I think her videos on Instagram, I don't know TikTok, but her videos on Instagram are the bomb. So
Thank
for,
you.
for a little bit of entertainment and a lot of knowledge, Julie's your girl.
Yeah, I try.
So thank you so much, Julie, for being with me today. It was an absolute pleasure. And I loved really hearing you share your journey into pelvic care and taking my class, pelvic care for acupuncturists, and kind of how that has manifested from a classroom environment into a reality and a missing puzzle piece in your clinic. That's just so cool to witness.
Well, thank you. I will say one more plug, by the way, because as you know, I'm taking your class again in a couple weeks.
You are.
So for those that are considering doing it, not only should you do it, but there's also an advanced certification that those videos are amazing. There's a lot. There's a lot of information. I finally know those pelvic floor muscles by heart, finally. But also in taking it again, A, I get to see some of my friends who've taken it, but also B, really fine tuning things because there's so much information that goes along with it that I'm certain that I'm going to walk away with a couple more gold nuggets that are just going to help, up level my treatments anyway. So that as well should be said.
That means so
So
much
see you in
to
a couple
me.
weeks.
I will definitely see you in a few weeks. And that means so much to me. Having practitioners that want to repeat my class because they want to get more from it is like, I think the biggest compliment I could ever receive. And that just feels really warm. And it feels like sharing this medicine, the sacred medicine of the pelvis with practitioners like you who just want to dive in and then dive in deeper. is how we are going to impact more of the underserved population. So thank you for being a pioneer with me on this journey.
Absolutely. My pleasure.